Hello, my good people. Dr. Imbaja here. Today, I want to talk about myths and misconception about the deadly disease that most of us doesn't take care of, but in existence, it takes away most of our beloved people. In essence, it's of importance to acknowledge that such disease or health condition can really give us stress in such an economy like Kenya. So today I want to talk about diabetes. Actually, we won't talk about the pathophysiology. We won't talk about much of the diabetes, but I just want to talk about the myths and misconception about the diabetes. First of all, what is diabetes? Diabetes is a metabolic condition or disorder that is characterized by sustained elevated blood sugar levels despite very less sugar content taken. In general, our body pathophysiology mechanism allows for inbuilt or self-control of the sugars. There's an organ called pancreas. Pancreas, there are cells that help produce a chemical or a substance that helps control the sugar. There are optimum levels that sugar levels in your body must not pass over or less. So when your sugar levels are way high, we'll call it hyperglycemia. When your sugar levels are way low, call it hypoglycemia. The hyperglycemia is deadliest. Likewise, the hypo is very much deadliest. But look, there are these myths and misconceptions that perhaps misleads us in the control or prevention of this non-communicable disease. When I say non-communicable disease, meaning if I myself am diabetic or hypertensive, in that case, because hypertension and diabetes go hand in hand, they are risk factor of each other. When I'm diabetic and I follow some of the advices that might be a vice against my sugar level control, then it means I might be heading to a wrong direction. Listen to this. In many young people, the Gen Z, the Alpha, or the Alpha Gen Z, all the late millennials will actually tell you that diabetes isn't a disease for the young people. This is wrong. Diabetes can be detected or diagnosed even in a neonate, a 1 day old, 1 month old baby. in a pediatric, in a child, in a youth, in adolescent, in a young woman, or an adult or elderly. But with age, it's more riskier than in young people. Meaning, in as much diabetes can get into young people, it is more or less compared to elderly. Because in elderly, most of the organs atrophies or start to lose the magnificent structural anatomy. Another vice that many people look is diabetes is a disease of the overweight. Not really. The substance that controls sugar, that's insulin, is not produced when you are fat or isn't produced when you are overweight. It is produced from the cells in the pancreas, and everyone has a pancreas. For example, when I take much alcohol, I'll be destroying the leaf-like organ, that's the pancreas. When I'm not overweight, I'm thin or slender, meaning my insulin levels won't be that high or produced, or they will be produced but in less quantity that cannot manage the amount of sugar levels in my system. Another thing is that diabetes can be cured permanently. Diabetes is managed. There is no any studies that shows that you can cure diabetes completely, because it's dependent on the action of insulin from the beta cells in the pancreas. That diabetes can be controlled by taking a lot of water. Look at this. One of a sign that will show you that you are diabetic is thirst. When I'm thirsty, I'll take a lot of water. Doesn't mean I'll be controlling my sugar. There's so many myths and misconceptions that comes around. If you go Western area, not all of it, some of the people or Kumbani or wherever, in African culture, we largely depend on the herbal medicine. But I'll advise that let's go medicine or drugs, or the English drug than African. Because if you compare the control of sugar with the hypoglycemic agents, that metformin, glucosamine, glycoside, compared to the herbal medicine that I don't know or prefer, most of the people that depend on the herbal drugs or leaves will tend to come with more severe complications of diabetes, such as diabetic foot, retinopathies. Some can have stroke. The immediate ones will have diabetic ketoacidosis or hyperglycemic osmolar disease. Look at this. Diabetes is managed. If you adhere to your clinics or medical clinics, then your sugar will be controlled at par. Don't